Hi, good evening. Steve Adler. Got a minute? Let's go through some numbers, a couple of announcements, a couple of new graphs for people that like seeing graphs. Let's begin with the city dashboard. This is when we start with new admissions down to 15. As you can see, we're doing a great jobs. We're sufficiently below orange at this point. I think Dr. Escott is considering making a move. He appears tomorrow before the city council and before the commissioner's court. We may learn some new things. But 15 new admissions, that takes the 7-day moving average down to 21. 154 new cases today. That 7-day moving average for new cases is 212. See the graph in the middle? That's the graph of new hospitalizations. And you can see that it's heading down. We have different indicators that indicate that this one shows it going down. We have some that show it, flatter, but it's still moving down, and that's good. I'll remind you that cities that get to where we are right now across the country and around the world end up relaxing, and then they shoot on back up just the same way we did in June and July. So we've got to keep our foot on the brake. We have to keep wearing our masks, doing our social distancing. Let's look at the mint numbers in the middle. Number of hospitalized, 7-day moving average is 196 tonight, or last night at midnight, actually. We had 171 people hospitalized, so below the 196. ICUs, 58 in intensive care units, below the 7-day average of 69, so still headed downwards. Ventilators, 7-day moving average is 46. We're down to 39. So again, also below the 7-day moving average. Where we are right now on new cases has a doubling time of every 111 days. Remember, it was just a little over a month or so ago that our doubling time was getting down to 15, 16, 17, doubling every 15, 16, 17 days. Now we're up to 111 days. I want to remind you that if you want to get a test, now's a good time to get it. Fewer people are signing up to get the test, means more are available. We're going to start, doing more and more strategic testing in the city. Let's go ahead and I want to show you some new graphs that are on that middle. If you click in the bottom right of that cartoon one we were talking about that had the ranges on it, you get this. That's the one right there that we see. Click the bottom right on the city's website. You can see the number of new cases. The 7-day moving average is the line that you see. And you can see where we had the spike on cases. Let's click to the next one. This is the 7-day moving average on hospitalizations. That gets us down to the 196 number off to the right that you see in the bottom left-hand corner in the mint numbers. You can see we've cut our hospitalizations in more than half. You click on that button again, and it gives you the 7-day moving average for ICUs and that's the ICU 7-day moving average, coming down to 69. And then let's look at ventilators. Similar kind of pattern with a number coming down. That's the most lagging indicator other than deaths, so it wouldn't have the same kind of decrease over the peak yet. All right, let's go to the next dashboard. This is the second city dashboard. Those 154 cases get us up to 25,890, deaths 362. That is 5 more than we had yesterday at 357. Still a deadly disease, one of the top 4 causes of death right now in Travis County. The numbers in green, you can see that's the actual number for hospitalizations, vents, and ICUs. You can look at some of the demographic information. Again, showing that our greatest challenge is with the Hispanic community. We have to continue to focus on that, even as the numbers are coming down. They are coming down for the Hispanic community, but have not gotten to the place that the white population or the overall numbers are. At tomorrow's meeting with the City Council, Dr. Escott, when he talks to the council as well as the Commissioner's Court, is going to talk to us about infectivity. He's going to introduce some new graphs that will also show up on our website so that you can pull up infectivity over time. That's a number that we have to kind of look back to get, because on any given day we're still filling in 3, 4, 5 days before that. But we'll be able to see infectivity over time. We'll be able to see it overall and aggregated. We're also going to be able to see it by demographic breakdown. So those are the numbers. I want to remind everybody that the application is open for the rent program. This is getting people rental assistance. It's about $13 million almost, $12.9 million available to people in the city. 70% of it's going to go to people who make less than 30% mean family income, 30% going to people making 80% mean family income. That's about $74,000 for a family of 4. So you should apply for that. They're going to have a kind of a lottery within the drawing for people within those groups. So please, if you're eligible, make sure that you apply. I want to talk to you about something that is kind of ugly that has arisen. You know, the Austin Parks and Recreation Department, PARD, and the Austin Public Health have worked out a way to keep public spaces open as much as possible for as many people in the community as possible. We need to open them and make sure that we can do it in a way that doesn't have groups gathering, because we can't let the use of public spaces contribute to not being able to open up schools or not being able to open up businesses. We have to be able to avoid clusters. So the parks people are there. Trying to people sign up for certain areas where if you just let everybody go that wanted to, we would have too many people too close together. You can sign up to go. We have park staff that's there to help. But what we're finding is that the Austin Parks Department, park rangers and park monitors have now begun to start to show up having been assaulted. Both physically and verbally on at least 6 different occasions. You get yelled at or cursed at, pushed. One park official got pushed into the lake. They've been threatened with weapons, punched, and pushed to the ground. And as mayor, I'm adding my voice to those that say that has no place in our city. And it's just outrageous that kind of conduct actually occurs. You know, these are employees that are working so hard to keep us safe. You know, they're there to help. They're not there for people to take out their frustration with COVID and the limitations that imposes. We are all looking for ways to get outside and be safe. Park rangers act really as ambassadors to Austin's park system. They help people who could be lost on the trail. They share information about how to enjoy the parks in the city. They provide educational programming to people who visit the parks. So what we're doing, obviously, as if we shouldn't have to ask, is everybody to treat our parks employees well and with respect. And please report anything that you see to 311 or 911. We should all be focusing on spreading kindness now, not COVID. We should be spreading kindness, and that's what it's just outrageous to hear and real disappointing to hear what's happening to some of our park employees. Students moving back at the University of Texas. University is working hard to try and make sure that those kids that weren't here to be part of what we went through this summer, understand where the community is, and show some restraint. Don't gather in large groups, so that they're wearing their masking too. And it's real important that we do that. We had some reports of some clubs that seem to have a lot of people bunching together outside, so we're investigating that right now. But by and large, university trying to keep everybody safe. They're going to be doing thousands of tests every week of students. So if there's an outbreak or a problem, we hope that the university will be able to find it so we can isolate it and control it. It's interesting, Ohio State University just issued 228 interim suspensions on Monday to students who broke the university's COVID-19 regulations around socializing. Northeastern threatened to rescind admissions to some of their incoming students who said online that they plan to come to school and party. The university saw the social media communications and then sent a pledge form to those students saying, sign the pledge that says you're not doing it, or we withdraw the admissions. UNC had some outbreaks on their campus. When they opened up, they sent all of their students home. Notre Dame had outbreaks on their campus. They didn't send everybody home, but they went to all virtual classes. So universities across the country are dealing with this challenge as best they can, and in different ways. We'll continue to work with the University of Texas to try to make sure that both the students and the community are as safe as possible, trying to learn the lessons that we can from other places. With that, every parent right now is looking to try to figure out ways how to occupy their kids during this period of time before school is back open again. And here's one for you. You should consider nurturing a love of drums. Drums. Now, those are brave parents. 9-year-old Grant began his lessons just before the stay-at-home orders started, and his teachers have worked really hard to ensure that he can keep things going online. He's kept up his lessons with the drums, and while he's been at home, taking lessons remotely. This is Grant. His parents, both of whom work full-time, say that the drums are just an absolute lifesaver in their family. So apparently it's working really, really well. So here, you heard it here first. Great at-home activity during COVID, drums. And with that, wish you all a good night. Y'all take care and be safe.